What's up, y'all? This is my appointment, my last appointment to meet with my surgeon. So we at my appointment right now. I'm definitely gonna keep y'all updated. I'm going to see how it goes before I get my surgery on January 2nd.
All right. Birthday. You're in pain after surgery. They will ask you numeric pain scale 1 through 10. How bad it is, So she wants to know. So you're going to record that. You're going to record the pain.
Okay.
On a percentage, how you feel.
Okay.
Please be very honest, okay, when you're feeling pain from 1 to 10, how many times did you take the medications, okay? And then they would like you to journal it on the pain, the day you took the pain medication, either non-opioids or opioids, okay?
This is when I'm at home.
Yep. Yes. Okay. Now, if you're in severe pain and you need opioid disposal, Dr. Friedman will only call it into these. These are the only Fairfield region. My fault. Fairfield region of the pharmacies that she can only send it to. So wherever you reside at, where do you reside?
I reside here.
Okay. So make sure you're on the phone. You need the opioid medicine because she's gonna call it in. You're gonna say 149 Prospect Street.
Yes.
You can go over there and get that opioid medication.
Okay.
Okay. So this is gonna be yours to keep. Okay. I'm gonna get a stapler. And this is what V wanted you to do. Okay, the quiz. Okay. So let me get the stapler. I'll be right back.
Okay.
And then we'll do that together. And
Thank you so much.
Your vitals.
Okay,
Okay,
thank
birthday
you.
girl? All right, let me grab that.
Hey, guys. So, unfortunately, today I got on the scale. I am 387. I'm at my doctor's appointment. This is my pre-op appointment for my bariatrics surgery, which is going to be on January 2nd. So, this is my last appointment to meet with my surgeon before my surgery. We at the finish line. I gained 7 pounds back, which I'm a little bummed about, but we're gonna get there. We on our way. I'm so happy. Today's my birthday. I'm excited. The new year is gonna be amazing for me, and I'm ready for it. I'll be back, y'all. Make sure y'all like, comment, subscribe. Comment some questions in the comment section.
Okay, Destiny.
Thank you so much.
All right.
This is my show y'all. I'm at the doctor's office. Yes, guys. I'm just putting this clip in here of the doctor's office. I'm so excited. I'm so excited. I've been waiting a long time for this. Been waiting a long time. Been waiting a long time for this. Finally here, I finally did it. I finally did it. And I thank God. I thank God. I thank my mom. I thank my kids. I thank myself for having the motivation, for being consistent, for having the drive to go through this. Today's my 38th birthday. And I told myself before I get 40 years old, I'm going to be more healthy. I'm going to do what it takes so I can live a longer life with my children. So I'm excited. This is the best birthday present ever. Lit. Okay, yeah. So I'm only going to stay one night in the hospital.
Yes.
And,
usually.
Okay. And after, when can I go start the gym?
So we want to walk in right away. You can basically start walking for exercise immediately. We're going to get you up and walking the same day of surgery. And then the gym usually about 3 weeks after surgery.
Okay.
The important thing about when you start working out at that 3 week point, you're still going to be on puree. So really important to be super focused on hydration when you start working out. And I wouldn't jump from like 0 to sort of really intense workouts. But yeah, as you start doing more exercise.
Treadmill, like I was going to do like treadmill like things.
Perfect. Yep.
So, what's the next question I had? So gym is in 4 weeks, 3 to 4 weeks.
Yep.
I see I was prescribed blood thinners.
So I just put that in today. And so that's for after surgery. So I prescribed 2 medications today. So omeprazole and Lovenox. So both of those are to start when you get home from the hospital. The omeprazole is an acid suppressing medication. We have everybody on that for 3 months post-op. It's basically just to help because the sleeve is such a big adjustment for your stomach. We basically want to suppress any, potential reflux while you're healing, but then we would stop it, after 3 months, if you're not having any reflux symptoms, we would stop it and just kind of monitor clinically from there. Okay. And I put a special instruction in, which is that the omeprazole is a capsule. And what I want you to do when you start taking it post-op is actually open the capsule and mix the powder with like liquid or soft food, depending on which stage you're on at that time.
Okay.
And take it that way. There's a little bit of evidence that it might work better that way for patients who've had bariatric surgery. Okay. The bottom line is, as long as you're taking it, I'm happy. But we're sort of having people take it in this open capsule way because there's some emerging evidence that it may work a little better that way.
Okay.
So the blood thinner is an injection. It's twice a day. Basically, there are multiple factors that we look at for someone's risk for blood clots, surrounding surgery. So anybody having any major surgery under general anesthesia is at risk for blood clots. But things that increase that risk include higher weight, folks with sleep apnea, folks who carry a little bit more weight in their legs and tend to get like leg swelling. And then obviously, of course, things like family history of blood clots, which I remember you don't have. But so because, that higher risk for blood clots lasts for about 30 days after surgery. So we do 2 weeks of the blood thinner when you get home to kind of cover the worst of that risk. But actually the best way to avoid blood clots is walking, is just being up. When he did the endoscopy, it was just what we call like a diagnostic procedure.
Right.
He took some biopsies, which we always do. But he didn't alter anything. He didn't cut anything. Right. He didn't change anything. So it is an invasive procedure, but it's considered more of like a minor procedure than a true surgery. Yeah. It gets listed in your surgeries, though, in the computer.
Yeah, because she told me, she said, how many surgeries do you have? I'm like, I only had 2 C-sections. She was like, in the endoscopy, I'm like, yes, I did have that.
And it's under some form of anesthesia, so it's kind of like potato. It's like... Okay. That's just sort of a matter of semantics, but that he didn't alter anything when he was in there.
Yes. Okay. Great.
Let me do a quick. I just want to feel real quick. So one of the ways that the weight loss pre-op helps is that it makes your abdominal wall like more flexible. So if it's okay, I just want to press on you a little bit and feel. You can just lean back a little bit. Perfect, and just kind of relax all your muscles. And what I'm feeling for. Yeah, awesome. So your abdominal wall is a lot softer, which is what we want. And I can feel where your ribs are. Now, I could when I first examined you too, but anytime somebody loses like a significant amount of pre-op weight, there's 2 things that it does that helps with surgery. One, everybody has fat in their abdomen. Right. Like every single person has a covering of fat over their organs and also like sort of this curtain of fat that kind of rests over the top of the intestine. Right. But if sort of the heavier someone is, the thicker those layers get, and that can make the surgery really difficult. So that sort of those fatty parts of the belly respond to the pre-op weight loss, and that actually really helps with the surgery. It makes your liver smaller. The liver can sometimes, because basically the liver's over here on the right, but the left side of it extends and kind of sits right over the stomach. Okay. So some people, if they're, and to do the surgery, I have to get all the way up to the upper, like the very top of the stomach, which is up really high, sort of under your ribs, under the diaphragm. And if the left side of the liver is really thick, I actually have to put in an instrument during surgery to hold the liver out of the way to be able to do the surgery. That's for everybody. But if that part of the liver is really thick, then it can actually sometimes be so big that I can't get to the part of the stomach that I need to. So first, that's part of the reason. And as BMI goes up higher, the risk of the liver being significantly bigger goes up too. So that was part of the reason for the pre-op weight loss as well.
Okay.
Making sure that we can kind of, get that liver a little bit thinner, and the combination of those two things, decreasing the fat around the organs and shrinking the liver, that's those are two main